All right. Hopefully you guys can't see my email, but you can see the screen. Oh, thanks, Joanna. I was like, can someone give
We
me
can
the
see
thumbs?
it. We can see it. Yes.
All right. So real quick off the bat, I like to start with some etiquette and not the kind you're expecting. So I really, really deeply appreciate engagement. So if you have a comment, a question, a thought, a half-formed thought that forms in your brain during this presentation, I highly recommend and encourage you just unmuting and blurting it out or shouting it out. You can put it in the chat, but I might miss it. If you hold a digital or real hand up, I might miss it because my eyes are on the screen. So really just unmuting yourself, offering that question, that thought, that comment, that feedback. I really think that helps both myself in the presentation, but also you all as thoughts come up. So I just encourage that. I know sometimes we're not sure on the etiquette, but in this particular case, I'm giving you full permission to just unmute whenever you feel the need. I see lots of familiar names in this group today, so I will just say apologies up front if you've already heard me talk about this. I tend to be a bit of a broken record because this is a very mission-driven passion project for me. But essentially today we're going to talk about strategies to promote behavioral health in school settings, and it's going to be probably untraditional for some of us who are primarily educators who work in school settings. The question today is, how do we build the best possible school communities for kids? And so we'll be answering that throughout. Just a little bit about me, for those of you who don't know, I spent about 15 years in K-12 education as a classroom teacher and also as a teacher trainer for those who were pre-service, and also helped to develop an effective model for middle school programming in a small rural town that I worked in. I consider myself as a public health, public education researcher and really a prevention scientist. I look at the interaction or the intersection between public education and public health, as well as community and school partnerships and adolescent health and development. When I started my career, actually, like I said, started as a 7th grade teacher, and I realized really early on that I could deliver content. I knew how to design a lesson to get to the content goals. However, what I was less prepared for in my teacher preparation was really all the other needs that young people came into my classroom with. And so when I went back to graduate school, I went back with a laser focus. How do we make schools the best possible place they can be for kids, so that not just their academics, but really their whole self, their whole well-being, however you want to talk about it, really is able to thrive and meet their full potential. And through that work in my doctorate program, I met one of the researchers for the Icelandic prevention model, and that sort of veered my career towards prevention and towards this idea of how do we bolster communities or bolster environments to make them productive for young people. So when we moved to Idaho several years ago now, 6.5 years, I found out that young people in the state of Idaho were really struggling, and so were professionals who cared about and worked with young people throughout the state of Idaho. Were really struggling with what they were calling the Idaho youth mental health crisis. And so I took my experience as a classroom teacher and educator, I took my experience working with the Icelandic prevention model, and we created Communities for Youth, which is an initiative that's Idaho-based, just focused on how do we build the best possible communities for young people in Idaho. And so I'm going to unpack that a little bit here today. I'm going to pause just in case there are questions or comments right now, just to practice those muscle skills of interrupting when we like. Okay, that was your first chance, but you'll have many more. So Communities for Youth, like I mentioned, is an Idaho-based initiative. We're focused on improving youth mental health and well-being through upstream prevention. And if upstream prevention is a new term for you, don't worry, it won't be by the end of my presentation. One of the things we do at Communities for Youth is really trying to build community capacity for upstream prevention, which means that we are not telling communities how to do something or even recommending what they do. Instead, we're listening and staying close as a supportive partner with our communities so that they themselves develop those skills and grow through to be able to support upstream prevention in their own community. We also collect robust and valid data on risk and protective factors at the young people level, so from young people, to help communities respond to young people's actual needs and measure their actual success. So if you're on the call today and you're one of those folks who works with schools or in communities with young people, y'all know we often go from what we know. And so if we do a particular job, we often see that as the particular issue. And what we really endeavor to do at Communities for Youth is help us all share an understanding of what is actually going on for young people. And that starts with collecting real, valid data at a population level. So often, for instance, in some of our communities, our response rate is 83% of the young people living in that community. So that is an overwhelming number, which means we can feel really secure in what we're seeing in that data. And then last, what we do is work with communities to facilitate and support efforts and resources that directly benefit kids in the community. So often, or a lot of you are probably aware of the community schools model. We are big fans of that model. The idea is we can all be working together and playing a role within our sphere of influence in order to make life better for young people. So some essential questions for the presentation today. I told you upstream prevention would come back. So that's question one. We also have, what are some of the benefits of upstream prevention? How does upstream prevention work within the context of schools? And what are the examples of this work in Idaho? So again, overall, we're thinking about how do we improve behavioral health in schools? And I'm going to talk through these things as that answer to that larger question. So first, just to set the stage, and I know many of you came here today already well aware of this, but I think it's important just to mention the depth of this problem so that we can really start on the same page. One fact that I like to share with folks, because this is a population that is often dismissed, is that girls 10 to 14 unfortunately have the fastest growing suicide rate in the nation. That started in the early 2000s and has continued on a very steep upward trajectory for suicide rates. I say that because we often consider young women, particularly at this age, we dismiss their feelings as hormonal or linked to puberty, or, oh, they're just being dramatic. And in fact, young women are actually bearing a disproportionate burden of suicide at this age group. And so it's important for us to recognize that. The second thing I think is important to talk about is that young people, because of the way their brains and lives are developing, are particularly vulnerable to mental health challenges, which means we need to recognize and understand that this is a population we need to be intervening with and preventing mental health challenges. Unfortunately, the way people's brains grow is that when we are young teens into teenagers, we're mostly developing our emotional system in our brain. And so this means that we are craving high highs and low lows. And in fact, young people need those things in order to have healthy, full development. And so they're going to be seeking novelty and high highs, low lows. And unfortunately, at the same time, their prefrontal cortex, or the part of their brain that's responsible for reasoned decision-making, long-term consequences, abstract thinking, that is not developed really until we're 26 or 28, depending on your gender. And so you can see there's a great mismatch of young people wanting new, big emotions while they don't really understand impulse control and what the impacts of their behaviors are. That means they're just particularly susceptible to mental health challenges. And finally, just to kind of make sure we're all here together, Idaho, unfortunately, ranks among the highest in the nation for youth depression rates, suicidal deaths. And this is not a new problem. This is a problem that has persisted over the last 2 decades. And so we're coming here to talk about that today. It's not just an Idaho problem. In fact, you might say we have a national or even a global youth mental health crisis. In fact, our US Surgeon General has called this out as one of his key areas of importance, which is that young people are struggling. Right here on the screen, what you see is the most recent YRBS survey results. This is a survey that's given nationwide to young people throughout our country. And unfortunately, what you're seeing is that young women on this survey had the highest rates of experiencing sexual violence, the highest rates of persistent sad or hopelessness, and the highest rates of seriously considering suicide in the history of monitoring this in our country. So if you feel like people are just like, oh, youth mental health, it's a crisis, and you feel like it's something maybe trendy or that a lot of people are talking about, in fact, the data shows that it is the worst it's ever been in our country. And so I just really appreciate you all sitting on this call with me today, because it's really important that we're all working on this and focused on this. And you might say, great, Meg, you just gave me something about the whole nation, but how does that relate to Idaho itself? This is an example, just one snapshot of the survey data that Communities for Youth, my team, collects. And this is showing that in our most recent survey with young people in Idaho, 30% of middle school students and 44% of high school students were scoring at the moderate to severe level of depression symptomology. Why I share that cut point is because at that level, a clinician who saw that ranking of moderate to severe would suggest clinical treatment of some kind. So whether they see a professional, et cetera. So at that point, that's a clinically relevant cut point. And so we're seeing a large portion of our Idaho's youth recently experiencing this. And so I know it can feel like this, right? We're often like, oh my gosh, the room is on fire. And that can be really challenging. And so I just want you to look at the time. That's the last of the bad news I'm going to give you. And I'm going to focus on all the good news now so that we can get out of this fire together. As you saw, the scope of the problem is big, right? You saw it nationally, it's big. Here locally with our young people, it's big. And so unfortunately, we have to match the scope of the problem to the scope of the solution, right? We have to have a solution that's big enough to hold the problem. And unfortunately, just like these kids who are covered in paint, right? We cannot approach it with a Q-tip approach, right? If I said, hey, here's these kids, and I handed you a Q-tip and we're like, clean it up, you would look at me like I was a wild woman. You would be upset with me. You would not appreciate me giving you a Q-tip in this case. And yet, so often, this is how our communities, our schools, our state, and our country deal with mental health. We try to solve it with Q-tip solutions like a great mental health care speaker or a prevention program on suicide. And yet there is so much more we need to do because the scope of the problem is large. And so today I'm going to suggest that upstream prevention is that right-sized, right-scoped solution that we're looking for. And again, I told you we're going to move to good news. Good news is we all have the power to contribute to this upstream prevention. So if you're wondering what is upstream prevention, I will talk to you a little bit about it. But I wanted to just give a pause to remind us of our etiquette that you are welcome to unmute at any time if you have a question or a comment. So I'll just give you a minute. All right, I can feel it. You guys are getting closer. You're feeling more comfy with it. And again, the way my screen is set up, I don't see the chat. So if one of our moderators is watching the chat and there's a question in there, just let me know. So again, although it's really great to have a lot of mental health clinicians, and in fact, I work closely with many of them. Some of my closest friends personally are mental health clinicians. They are certainly part of the solution. Same with a speaker or a prevention program or coping strategies, right? All those things are part of the solution. But what we need to do is come around a community and to think about what are the ways in which we can make our school community the best possible place it can be for kids. And the way that we do that is by identifying what we call protective factors. So these are things that we know protect young people from risk of mental health challenge, substance use, etc. And we want to increase those protective factors as much as possible. We also want to decrease risk factors, right? So risk factors can make it more likely that young people struggle with their mental or behavioral health. And so these are the things that we want to reduce. And this is what an upstream prevention strategy does. It thinks about what are the protective factors and risk factors and works at that root cause level rather than chasing every fire, right? So I know you all, especially those of you working in our education settings, are chasing fires right and left, right? It's Tide Pods and vaping and fentanyl, right? And you're just inundated with all these things. And society continues to ask you to be experts across all of these things when what you are experts in is schooling and education. And so what I love about upstream prevention is that it actually allows you to do the best work of being a school or an educator again. And we'll talk about what I mean by that. Upstream prevention asks the question in this metaphor, how do we keep the floor dry? And how do we sustain that dry floor in an effective way? And so what I mean by that is right now, if we think about mental or behavioral health as a crisis, and let's say the bathtub is just overflowing with water, right? We have mental health care providers desperately trying to keep that floor dry, right? They are mopping it up. They are sweating on their brow. They are working hard to keep the floor dry. We've got people in the middle doing some training and they're bailing out that bathtub as fast as they can. And yet we're still in crisis. We've maintained this crisis for many years. And so upstream prevention, what it asks is, how do we turn off the tap so that all of us can do our work without being extremely overwhelmed? And the way that we do that is we think about the conditions that exist for our young people at all these different levels and how we might improve those conditions based on what we know. And so, of course, there are things at the personal individual level that impact this, right? We know that people are naturally born sometimes with prevalence for mental health or not. We know that their preferences for things they're good at or hobbies or passions or people, etc. Those are all at the individual level, and those are important. Things like individual coping skills. But in fact, what we want to be doing in upstream prevention is looking across these multiple layers. And so if you notice, schools are actually represented on this right here in this yellow circle. And this is really thinking about the policies, the practices, the norms that support those risk and protective factors and the connections between staff and admin and students. And I don't just mean staff to students, I mean staff to staff as well. So some examples or some more information on risk and protective factors are that they make it more or less likely that a health outcome will occur. And so some of you, those of you especially who are my students, have heard this example of a risk and protective factor. But I used to live in West Virginia, and West Virginia is an extremely hilly location. I mean, you do not move anywhere without seeing at least 3 hills. And so I did not, if you can imagine this, bike a lot in West Virginia because it was not fun. I ended up getting off my bike a lot and lugging it up the hill, right? Here in Boise, where there's a flat green belt and there's lots of flat things, no hills around, I bike all the time. And that's an example of changing the environment, right? A risk or protective factor that makes it more likely that the health outcome that I'm moving occurs, right? And so that's what we're trying to do essentially with mental health and children's well-being is think about how do we make the environment like the beautiful flat environment in Boise that makes it possible for me to ride my bike. Some examples of risk and protective factors for mental health are things like having authentic relationships with peers, friends, and family, sense of mattering and belonging. A risk factor is having high levels of stress, feeling a lot of pressure. And in fact, when we do focus groups with young people around this state, the number one thing they talk about when we ask them about their stress or their mental health is really this feeling of pressure that they have to excel and exceed from we talk to like 12-year-old kids who are already talking about their entire college and economic future trajectory, right? They are feeling pressure to be excellent and the best at not only their school, but also their extracurricular, because they are thinking that everything in their future relies on how well they're performing now. And that's a lot of stress for a young person, particularly when you consider that their brains are not fully developed to hold all that. Another risk factor we're seeing throughout Idaho is a lack of sleep or physical activity. And another protective factor is a sense of purpose.
So I think this is a perfect time to bring up, there's a comment in the chat that kind of goes along with that. And the comment says, it's from Sylvan, and it says, I'm unable to unmute, but after seeing in my own town of Middleton, Idaho, how suicide has affected it, why do you think that it is so high in Idaho? Is it a lack of mental health awareness, a lack of parents' knowledge, the low wages of families, which cause more parents to be working rather than being at home with their children? I just really am curious as to why Idaho's rates are so high.
Sylvan, thank you for your question, and I'm so glad you jumped on the chat. Thank you very much. I think this is a question we get a lot. And I think that my team, we're starting to get at it, but we've just started collecting data in the last 2 years and not all throughout Idaho. So we don't have a comprehensive picture of Idaho, but we are definitely striving to understand more. I can speak to some of the data that we've seen so far to start getting at the question. And the unfortunate answer, which you don't want to hear, is all the things you've suggested are part of it, right? We have families and adults not understanding exactly how or what to do to support young people. We have a lack of equity throughout our communities that disproportionately puts a lot of these risk factors on young people. And so I think, unfortunately, the short answer is that all of those things are factors. The medium answer is that we're endeavoring to figure that out at a state level. And right now in the communities that we're working on, we really are able to see which of those risk and protective factors, like some of the ones you named, are really truly leading to depression or leading to suicidal ideation in that specific community. Because although you've named these broad stroke issues, they look different, I promise you. In every community we're in, there are different factors that are really prevalent for those young people. And so that's why the data piece of what we do is so important. And I think that's where I'm going to stop on that right now, because I could say a lot more, but that's where I'm going to go right now. Thank you for that voice, whoever was that. To talk a little bit about our process, this is the upstream prevention approach that we take. The first step is building a community coalition. And why I think this is really relevant to schools, and again, reminds me a lot of the community schools model approach as well, is it is important to build goodwill around a school and to connect a school, rather than the approach we tend to take in the last about decade, which is every societal ill, now we're just going to pass it off to the schools and say, schools, now you have to fix homelessness and food insecurity and mental health and do this and that, right? That's a lot for schools to stand in the gap. And many schools are working very hard to meet all those demands and needs of their communities. But what we want to do is build a group of humans around that school and around the young people in that school community to say, you know what, we're just committed to making the best possible place for kids here. We're part of that coalition. And so that's step one. Step two, like I said, is that really important data collection piece. And so we're going to go ahead and collect that data, and we're going to know precisely in our community, where are our risk factors, right? Because it's only so much to know that certain amount of kids are struggling. What is it that our kids are struggling with, and how can we effectively approach that? Step three is a really fun step for me, because that's when we get to engage with the community and talk about what we learned in that data and learn from the community about what they're seeing in their community and what they'd like to see happen. And in those meetings, we set goals and we decide to take some action. And then the last step is really about expanding that conversation largely to the whole community. And unfortunately, what tends to happen is this, right? We're all used to this picture, and you can take some time with my amazing clip art here. But essentially, the idea is the researchers, we're off in our own world, writing research reports only to other researchers. It's a really unfortunate part of our lives, right? The worst part of my job is that I spend a lot of time doing research and writing research that only researchers doing nearly the same thing I'm doing are reading. And then we have policymakers doing their best to write policy, but not having the time or the expertise to really think about that policy and not talking to the practitioners. That's many of you all in the field, doing the work, trying your best to keep the boat going, right? And then finally, I added this last picture to this slide after we did our listening tour throughout the state of Idaho, because so many of our community members and our parents felt like they were not even on the boat with practitioners, with policymakers, with researchers. They were in their own very lost, very alone place. They wanted to help, but they had no idea how. And so the work of upstream prevention actually brings all these pieces together. We build through shared evidence what our approach will be together. And one of the things that I think gets missed a lot when we talk about research evidence is that people think of just like whatever research says. And I will tell you that just research alone does not get the work done. These three circles of evidence are in fact really important. And so one is, of course, best available research evidence, right? What is working in other places around this? Yes, we bring that to the table, but there are two other major pieces of information we need to be successful. One of those pieces is contextual evidence. And this is that piece where we collect data in communities from young people to say, what is truly going on for you? This third circle, this purple circle, this experiential evidence, this is the beauty of that step 3 of our approach, which is we bring both those yellow and blue bubbles back to the community and we say, okay, this is what we've got. What are you seeing here? What do you want to do about this? What's possible here? And really that lived experience of our community members is what makes upstream prevention work and is a key important part. So we had a question earlier about Idaho. I will tell you that so far in our survey data, our two major leading risk and protective factors across multiple communities for predicting both depression and suicidal ideation are the experience of social isolation, which means a lack of true, deep, authentic connections, and high levels of stress. The other 4 bullets you see here are the other top prevalent issues that we see in some of our communities. So a lack of sleep in young people, a lack of family support. And so this is a perception that we cannot share our problems with our family, etc. Experiencing dating violence, unfortunately, is one of our leading factors in this state. And experiencing discrimination against gender, race, or sexuality is also a leading factor of depression and ideation for Idaho youth. So just to give you an example of some of that data that we collect and what that looks like, here is one that looks at depressive symptomology and duration of sleep. And so you can see this is the group with 8 hours or more, those 2 bars on the right. So this group is getting almost the recommended amount of sleep, right? So the recommended amount is 9 or more, but we'll take 8. And then this is the group getting 7 hours or less. As you can see, they have a much higher rate, this gold bar, of moderate to severe depression in that lack of sleep category than they do in getting enough sleep, right? So if I'm getting enough sleep, I am way less likely to experience depressive symptomology. So the cool thing about upstream prevention is none of us need to be experts in mental health, right? To make an impact on depression. With just this slide of information, we know if we just do things that increase sleep for young people, we can go a long way to help with depression. And again, did not need to be an expert on mental health, right? So one of the cool things, I'll give you a specific example in our school community where they saw this data. We also followed up with focus groups with young people and we said, you know, what's holding you back from sleep? And of course, you all know, because you've been in educational settings, one is athletics, right? That's a pretty big ball that they're working on. Another was that they had assignments due at midnight. And sometimes their teachers would like add to an assignment or make an edit later in the evening. This combination of things made so that the norm was that students would wait until late in the evening to look at the assignment to make sure they had the most, relevant version. And then it meant that they would stay up until midnight to complete the assignment. So when we talked about that experiential evidence of the community responding to what they were seeing, and we talked about the data here, the school did something immediately about this. They made it so that no assignment was to be turned in past 9 p.m. So all the teachers had to change that little p policy and make assignments due at 9. And just that simple task has increased sleep hours. And so this is an example of how using this data, we put it into immediate action right away. And none of us had to be mental health care providers to do that work. This is another example of a protective factor. So if we think about student stress as being a poor mental health outcome, and we think about connection to a trusted adult, right? And the cool thing about sharing this with educators and people who work with educators is that our teachers, our principals, those are such a wealth of trusted adults in our community, right? And so you can see their extreme protective ability. So if you see, this is the group that says, I do not have a trusted adult. And this bottom set of bars is the group that says, I do have a trusted adult. And you can see that this gold is high perceived stress. So those who do not have a trusted adult are much more likely to have high perceived stress levels than those who do have a trusted adult. And so again, this is an opportunity where you do not have to be a mental health expert. You just have to say, I know if I'm preventing mental health, I'm going to be a connected, safe, trusted adult. I'm going to help my young people identify safe, trusted adults in their community, in their spheres. And so this is the way that protective factors can really help us. This is my slide. It's an homage to our educators who, like I said, society right now, for whatever reason, just looks at you every time there's a problem with young people, right? They say, oh, young people are doing fentanyl, schools solve the problem. Young people's families are struggling, schools solve the problem. And so I just want to say that I was an educator. I know how that feels. And our work, what we endeavor to do through upstream prevention and our community and school partnerships is actually lighten this load and let you go back to education and what you really endeavor to and dream well. Some of the things, the benefits of upstream prevention are that the process doesn't change. You saw those 4 steps. Our goal is to make that process so habitual in a community. Again, who cares about kids? Who wants to be part of that group? What's the data say about that group? What do we want to do about it together? And how do we share this message with everyone in our community? Those 4 steps become a habitual process that help communities, that develop communities' capacity to do upstream prevention work. It builds their capacity to sustain attention instead of putting out every little crisis fire, right? Like vapes or fentanyl or whatever the newest thing is that we don't know of yet, right? Instead of chasing every single one of those crises, if we stay habitually in this process of let's keep the focus on kids and how to make this the best possible place it can be, we are actually doing way more for prevention of all those poor outcomes than if we chase one outcome at a time and focus on one outcome at a time. And then finally, what I really love about upstream prevention, especially for schools, is that it finds a role for everyone who wants to be a part of the solution. Everyone can play a part, right? When you go out to a community and you say, you know what young people need? They need trusted, safe adults. That is a way to invite everybody into the solution. They don't have to be a fentanyl expert, right? They don't have to be a mental health care provider. They can build connection for young people. And the best part, perhaps, about upstream prevention is that there's evidence that it works really well. Here is a chart that shows many decades of upstream prevention work in Iceland, where this prevention approach began. And you can see that their rates at the very beginning, especially for alcohol, were out of control, if you don't mind me saying. 42% of their 10th grade students were drinking to the point of drunk in the past 30 days. That is a high range of substance use. And in fact, when they did this, when they started this work in Iceland, Iceland had the highest rates of substance use in all of Europe. I'm happy to say that as they stayed with upstream prevention and built it into their communities, into the fabric of how their communities responded, particularly the way that their schools responded, you can see that the line continues to decline over time, over time, over time, and hold steady. In fact, if I were to update this chart for today, it would still be holding at that 5% rate. I challenge you to find me any substance use program, training, speaker, etc., that shows that rapid decline and that sustained decline over time. It is incredible what we can do together as communities when we decide how we want to make the best possible place for kids. So if right now you're like, okay, I'm kind of interested, I hope you are, then you're probably thinking, okay, how can we support young people in Idaho? And one of the things that we found prevalent in every community, as you saw, was social isolation. And so we are doing a full court press, if you will, if you like basketball metaphors, on youth social connection. So as a school, what I want you to be thinking about is, how do we build social connection for young people? And so there are three major buckets in which we grow social connection. One is connection to self, okay? And young people need to explore the possibilities of their world. What am I like? What's my role in this world, right? What's possible? What does history say? What does my future say? They need to explore purpose. They need to feel some autonomy and competence and some self-awareness about where they are and what they're feeling. The next bucket is connection to peers. And this is how we scaffold connection, right? So it is not enough for us to say, hey, young people, go connect. You need connection, right? Instead, we need to think about how, as educators in our classrooms, do we scaffold connection? So especially over the years of COVID, but even before, with the advent of social media and things like that, our young people have less skills than they may have had even 15 years ago in connecting to one another at an authentic and deep level. And so we need to think about, how do we scaffold this? How do we make activities in class bring kids together, share themselves with each other, and scaffold some of those questions? And finally, another way we can increase social connection for youth is connecting them to trusted adults. You can be a trusted adult if you feel like you're in a great position for that. You want to lead with listening and not advice. So hard, I promise you. As a teacher, it is hard. As a parent, it is hard. It is hard to listen to a young person's struggle and not offer advice. But really, the way that we build that connected and trusting relationship is leading with listening. And I have this one phrase that I like to hearken back. It's my mantra when this happens, to try to keep me in just listening, which is, would you like me to just listen, or do you want some advice? And that gives the ownership to the young person, and they can decide what they would like from you. You want to notice kids. You want to make sure that every child that is in your realm knows that they are important to the world. And this can be so simple. People ask me all the time, well, I don't want to feel like a creepy adult. Just being like, hey, it does not have to be creepy, right? I do not recommend you all becoming creepy adults. Remember, it's safe, trusted adults. And so this is the idea that when you are picking your child up from a soccer game, just noticing one other kid that's on that team and being like, hey, Johnny, great kicking today. I really thought that was cool. That moment for that kid will be important. And so it can be as simple as those moments we cultivate. My favorite part about this slide when I'm talking to school audiences is this is what schools do, right? I mean, ultimately, when I think about why I became an educator, why I wanted to be a teacher, it was to provide the opportunities for young people to reach their full potential through exploring what they're good at, through learning about the world around them, and through connecting to each other and to the adults in their lives. And so what I love about upstream prevention, specifically for school audiences, is that instead of asking you to do another training, to memorize another set of skills, it calls you back to why you became an educator. Why you became an educator was because you probably had a passionate excitement about helping our next generation grow. And upstream prevention actually allows you to focus on that rather than all the external stuff that sometimes we put on educators and schools. So if we're building feelings of support and belonging in our schools and classrooms, we actually do way more. And this bears out in the data and the evidence across our nation, not just here in Idaho. If we are building this into our schools and classrooms, we increase academics, believe it or not, but we also increase mental health outcomes and wellness. We also decrease substance use way more than doing a DARE program or a mental health program or a suicide prevention week. This is where we get the real prevention. So what does this mean? It means thinking about the way in which your school builds a youth sense of value and mattering in their school community, and really allowing yourselves to go all in on that. And know that by working on that, you're increasing your academic outcomes, you're increasing mental wellness and well-being, and then it's okay to refocus on that. Closeness of teachers and other students. Are there ways that you can find fun, connection, either traditions, events, etc., that young people and teachers can connect with each other and across those populations? That is going to increase your academic outcomes as well as your mental health and well-being of students in your school. I think we really did a disservice when we started talking about the impacts of COVID in schools, and we were like, oh no, everyone's 2 years behind now. No, we are where we are. The best thing we can do as schools is remember that part of our job is to help young people grow and connect to one another. And then also we want to build those feelings of support and safety in various areas of their lives. So asking young people to investigate, where are the supports in my life? Where are the areas of safety? What are the protective factors that relate to me? That can be really helpful for a school to focus on. So if you're thinking about this now, and of course I can't cover everything in a quick hour, but if you're thinking about this, here's some ideas of where to start. And then I highly recommend, if you're excited about this and you want to keep talking to me, I'm sorry, you've heard a lot from me today, but I love to talk to anybody anytime about this. And so I really recommend that you reach out and we can have a phone conversation. I can come out and talk to your school, etc. But the idea is some of the things where you can start is get a dedicated time for scaffolding youth-driven conversations. So thinking about the classes or the environments in which you can have young people drive a discussion. Taking a genuine interest in teens' activities. So if you're a teacher, you can start being more of a trusted adult for more students just by, and I know those of you who are teachers are probably already doing this, but just by being like, oh, you're in volleyball. I saw that you have a game this week. That is a really, if you are showing genuine interest in them, that goes a long way with young people. We can create schools and classroom traditions. Again, I think sometimes when we over-focus on academic outcomes, we forget that having fun and connection actually serves our academic interests, right? We need young people to feel good and connected, and then they are more likely to succeed academically. So again, upstream prevention calls us to get to the root of the issue. And the joy of getting to the root of the issue is that we can increase school climate. We can increase school safety. We can increase both school and individual resilience. We can decrease substance use and prevention, and we can prevent suicide, all by getting to the root of the issue, by diagnosing and treating at a community level rather than an individual level through upstream prevention. If you are curious about this, you are welcome to reach out to our school partners. We've been working in Marsing. We're now in our year 3. We're in Boise year 1 and Blaine year 1. And we have 2 new community areas coming on board in Nampa and West Ada. And so if any of those communities are in contact with you, you're welcome to reach out to them about what this looks like. And it looks different in every community, right? So in Marsing, almost the whole community shows up to our meetings. Obviously in Boise, it's a little bit harder to get an entire community in one room. But in each community, we do this work. Examples of some of the upstream prevention happening in Idaho schools are things like community listening sessions, where we're really trying to hear from the community and work across our differences to listen to and hear one another. We do data walks, again, where we collect data and present it in a very public-friendly way that anyone can understand and relate to, sort of like the data slides you saw earlier. We've had schools go to no phones policy on campus. We've had youth panels and groups and advisories, right? We've had professional learning communities focus in on how do we create increased connection opportunities or increased belonging, and et cetera, et cetera, et cetera. One of the coolest things I will show you and maybe leave you with today is that we started in one of our school communities 3 years ago. And unfortunately, and we checked and rechecked this data because we were really nervous about it, 66% of their kids, when we started our surveying out there, were at that moderate to severe level of depression. That means an overwhelming majority of their young people were clinically suffering from depressive symptomology. I'm happy to report to you that not by our work, but by all the community members, all the community organization partners, the school's leadership, and really pushing in on that, has continued to decrease so that only 3 years later, we're seeing only 24% of their students struggling with depressive symptomology. That is hopefully so inspiring to you, because I know when we start the presentation and we're looking at that room full of fire or that bathtub overflowing or all the doom and gloom stats, that it can feel so overwhelming to approach behavioral health that some of us might look away. And what I want you to see here in this slide is just through 3 years of work, we have made a overwhelmingly significant difference in young people's mental health. And so I invite you, if you're excited by this idea and the possibilities of upstream prevention, we are your partner in this. We want to work for you and with you because our children are worth running upstream for. I'll close here. 3 things that can promote mental health for youth in Idaho right now. Increase social connection. Again, we're seeing that over and over and over in the data. Our young people are hungry for real relationships. Let's give that to them. Let's help them get there. We need adults to take responsibility and commit together to do upstream prevention work, to own the communities in which our young people live. Often right now, our approach to mental health is like, okay, kids, you guys mentor each other and make each other feel better. Now, is there anything wrong with peer mentoring programs? No, but it leaves out the responsibility of adults and the community that we create for the young people that we care for. And then finally, one way that we can really promote mental health, to that question right at the beginning of our presentation, is really by collecting community-specific data. This data allows us to navigate our work. Instead of guessing at what young people need, we know what young people need and we respond to it. And then we check that work so that we're not just doing things and as adults thinking like, yeah, I like this program. Kids seem to like this program. No, let's check our work and make sure what we're doing matters for young people. And I will leave you there. I have left a little bit of time for question and answers, and that's always my favorite part. So I'm really excited to hear from you all. I will say thank you. I will say if you're curious about more learning about how to bring upstream prevention to your school or your school community, check us out on the website. Go ahead and send us an email. I am super grateful for all of that engagement.
Thank you very, very,
Jackie has a question.
Dr. Smith. Yes.
Hi, Megan. I put it in the chat as well, but I was hoping you would talk about the Idaho Youth Wellbeing Assessment as a first opportunity for a lot of districts to collect, data and information that will help them make decisions about where they could be working to support youth behavioral health, and as well as the toolkit that you'll be providing as a result of that.
Yes, I promise I didn't plant Jackie here, although she's always a great plant for that. Yes, so through our work and through actually some incredible sponsorship from BCI Foundation, the State Department of Education is offering all schools in Idaho a free risk and protective factors survey that we have created. So if you are a school out there and you're excited to know where do we focus, where do we start in this big upstream prevention approach, a free survey that's validated, a great measurement tool that we've used with success in the other communities is available to you now. If you're curious about that, you can see a link on our website. It's called the IDE Youth Wellbeing Assessment. And you can also go to their website if you'd like to see their information about it. All the questions are fully open. So we operate from a place of transparency. We want all parents and schools to know all the things that are on that survey. There's no hidden questions. The survey is also completely anonymous. And so no young person can individually be identified in any way. So it really allows us to focus on those risk and protective factors in our school community. Thanks, Jackie, for highlighting that for us.
So I have a question. I'm actually not from Idaho. I'm from Utah, and I was wondering if there's any way to kind of start pushing this program out of Idaho. Like, is there any work on that yet, or are we just trying to build it in Idaho first and then kind of push it out? Because I know Utah's statistics are kind of the same as Idaho's.
Yes, I would say we're definitely open to going to other communities. Right now, the Icelandic prevention model writ large, not necessarily for just mental health outcomes, but for substance use outcomes, is used in West Virginia and Vermont and Alaska. And it's also in 43 countries around the world. And so we're absolutely excited to talk to you. I encourage you to reach out and email, and we can talk about bringing it to your community too.
Perfect. Thank you.
Yeah, thanks, Nicole. I see Jason, you have your hand up.
So I'm not in Idaho either. I'm in North Carolina, and I don't really know a lot about statistically where we are in the great scheme of things. But I had a question specifically about the social isolation aspect. Is there any direction, like, does it need to be that young ones of a similar age, or does it need to be more connections outside of the family to qualify as a social connection? Or is it just any human contact and human connection is what the adolescents need?
This is such an awesome question. So thank you so much. Yeah. So social connection really relates to just people connection. So that can be through your family. It can be through trusted adults. It can be through peers. And there's even an element that is to yourself, right? So the idea is, a lot of times we get the pushback, well, you know, like so-and-so is struggling and they are the captain of the football team, right? But the idea is you can look like you have lots of connections, but you don't have what you need, which is those deep, valuable quality connections. And that differs. That level, both quantity and quality, differs across individuals. But the overarching idea is that if we don't have that need fulfilled, if I don't feel like I have enough quality relationships, then I am way more likely to be depressed and way more likely to think about suicide. And so I really appreciate your question, because it is sort of this word we throw around like isolation. We think just of like the lonely kid, but we can be lonely with lots of friends, right? And so I think that's something to keep in mind.
All right. Any additional questions? Feel free to unmute yourself.
This is my favorite part, y'all. I wish I would have left a half an hour. So if there are more questions, I'm in.
Yeah, I had a question about the depression rates over time.
Mm-hmm.
The study that you guys did with the 66% down to the 24%, was that following the same group of students, or are you tracking incoming students' rates?
So that is a population level rate. So it's not exactly the same group, right? So the seniors graduate and new sixth graders come in. So that's watching at the population level. However, I will tell you that the trend looks very similar when we look at cohort base. So let's say we just follow the eighth graders over 3 years. They also have a decline in the same direction.
So did you guys institute upstream methods with that younger population and you were able to see the differences in rates, or what were the factors?
Right. So we actually work with the community and the school at large. So not just with young kids, kind of in the whole community. And that first year we collected data, what was glaringly obvious, for instance, is that a population of young people felt like no one at their school was nice to each other. That was one of the risk factors that popped. So we built a whole campaign with the adults in the community, with the school leaders at that school, around how do we increase kindness, right? Because one of the awkward things is we followed up with focus groups and the kids were like, actually, it's the adults who are not nice to each other. And so we really knew we couldn't just talk to kids about how they needed to be nicer. We needed to talk to adults about being responsible to that, right? And then the second year, what we saw is a lack of connection and physical activity. And so what we were able to do is help the community figure out, how do we increase physical activity for kids and how do we increase social connection across? And so I hope that sort of answers your question, where we're working sort of at that community level. We have meetings with the school about what the school can do. We have meetings with the community about what the community can do. We have meetings with the students about what they can do. And so it's sort of a full court press to meet those risk and protective factors.
Thank you. Last question. You guys follow through with sleep and physical activity. Under that umbrella of physical activity, you guys look at nutrition too?
Yeah, so our survey itself does not look at nutrition, although we have potential modules. So Jackie mentioned that Idaho Department of Education survey. This year, we're working with them to increase optional modules, and physical health and nutrition keeps coming up. And so I imagine that next year there will be a module on nutrition and physical health.
I had a question. I don't know if this program kind of deals with it, but I was wondering if you guys have worked with legislative or the schools or anything like that with bullying. That seems to be a big issue, especially around suicide and things like that.
Sure. So we do measure bullying and bullying experiences on campus. And it is possible. That's the thing with an upstream prevention approach, is that in each community, those risk and protective factors look different, right? So in a community where, let's say, bullying comes up as one of the prevalent risk factors, yes, absolutely. We would work not just with policymakers, but also with school leaders and with community members and with students themselves about the real solutions to bullying. And the way that we do that, again, if you think of those 3 bubbles that I showed, it's by bringing in evidence where bullying prevention has worked in other places, but then checking that with the community themselves. So if you say, hey, we're going to do this cool training program, but you bring it to kids and they say, that's stupid, that's not effective, then we're not going to run that training program, regardless of what it says other places. And so that's really that key piece of this work that makes it successful, I think, is that we're not just doing things because we think they're great, we're making sure they're working while we're doing them.
Perfect. So with your schools that you guys have been working with, does it seem like bullying is a problem, or is that kind of just something that is being fed, another thing to add on to the teachers' plates?
I think bullying is an interesting construct because it is a very specific thing, but the term itself is used quite varietily, right? So some people describe just a kid as being mean to me, they're bullying me, right? And that is not actually bullying. Bullying infers a power dynamic, a consistent over time situation. And so it is not popping as one of the main factors here, but I think that's probably because we're working really hard to make sure kids understand what bullying means in some of these school communities. And so I think the bigger trigger is really that feeling of social isolation, which obviously can be really related to bullying, right? Like if you don't feel like young people are kind and connected to you, you may also be experiencing bullying. But yeah, it's not coming up as one of the main things here. But of course, bullying is just like Tide Pods, it's just like fentanyl, it's just like mental health crisis, it's just like suicide. These are all things we don't want for our young people. But when we focus just on the one thing, we kind of miss the whole pie, which is how do we make this community the best possible place it can be for kids? It's overtime, so I don't know the etiquette. I'm letting the leaders lead, but I feel bad. I am always happy to talk about this further, so
Absolutely.
feel free.
Well, we bend the rules for great presentations, and this meets that standard, Dr. Smith. Thank you so much, and thank you to all of our participants, and just for an outstanding. I learned quite a bit today, so thank you very much, Dr. Smith. And you guys, please keep your eye out for our next month continuing education session, where we'll be discussing evaluation. Should be around Tuesday, October 15th, but you'll receive communications on that from us going forward. All right, guys. Hope you enjoyed consumption of food and the consumption of just a wealth of information. So we thank you all. We'll see you next time.
Yeah, take care, y'all.
Take care. Bye-bye.